Good day, my dear students. Today, I have started a new session, namely Spotters in Hematology for you undergraduates. There are the two components within the box that shall be dealt with. There are two things again. One, it can be a theory question or a chart otherwise, and spotters, as you people know what it means. This is the first case. Always in hematology, we people should be familiar with the normal peripheral smear, which means RBC, WBC, and platelets. In the first one-third, it will be restricted to the RBCs. So what we are seeing on the screen is the RBCs are normocytic, normochromic. That means they are of the size of a lymphocyte. And secondly, you find that there is a central area of pallor not exceeding 1/3 of the diameter. It equals to the hemoglobinization on either side. Not much of poikilocytosis, which means no variation in size and shape. I would like you people to kindly compare these two pictures. On my left, I am seeing a normal peripheral smear, whereas on the right, there is something different. What is striking will be the hypochromia, that is the increase in the diameter of pallor and a thin rim of hemoglobinization. Also, there is a variation in the shape of the cells. And also, I could see that there is a variation in the size of the cell. Look at these two cells, for example. So the same picture again, it has to be described as microcytic, hypochromic. Anisopoikilocytosis, as I mentioned, variation in size and shape. These are incidentally platelets. Do not confuse them with lymphocytes. This particular diagram or picture is given for the sake of completion. A bone marrow interpretation is usually not given for undergraduates. But in this, I would like you people to kindly appreciate the degree of blue staining with the Pearl's Prussian blue in all the four squares. In A, it is almost nil. Here, I find a trivial presentation, and here it is moderate, whereas in D, I find it is marked. And in my class, I have explained the degree of positivity which you people shall recollect. I would like you people to kindly mention the differences. This for one, I find that the RBCs are microcytic, hypochromic, and smaller than that of the lymphocyte, poikilocytosis because of variations. This diagram you people can draw in your record also. Whereas in this one, I find that there is an increased number of target cells. So increased number of target cells and severe hypochromia should warn us about beta thalassemia also. So we shall have that as a differential diagnosis in mind. So this is what you people will have to explain. Thin rim of hemoglobinization, the ring or the pessary cells. These are all the ring cells, and pessary is a contraceptive device. Elongated pencil cells, that are the teardrop cells. So your diagnosis will be microcytic hypochromic anemia. Probably, in all probabilities, it is iron deficiency anemia. That should be the sequence with which you people express. Now I shall go on to the next case, which is this. Again, normal people should be familiar so that we can compare. Look at the picture on the left. I find that the RBCs are large. Not only are they large, they are oval in outline. Also, I find that there can be some teardrop cells which are present. So it is macrocytosis and ovulocytosis put together. I would like to call them as macroovulocytes. Also, the teardrop cells can be mentioned over here. There is another cell that is given over here, neutrophil deliberately. We will see the importance of it in the subsequent slides. So, these are the macroovulocytes that I am seeing. Look at the macroovulocyte, the teardrop cells, just like a drop of water, and the hypersegmented neutrophil. This you people should definitely mention in any of your answers. More than 5 segments and more than 5% of the neutrophils is indicative of hypersegmented neutrophils. Also, there can be inclusions, just as this or in this. I find that there are multiple blue dots which are remnants of the nuclei called as a Hall-Jolly bodies. Another one that can be found either as a circle or a figure of 8 will be the CABO ring, CABO. So let us see whether these are all identified by you people and written in your answers. So the diagnosis in this case is macrocytic anemia, probably of megaloblastic etiology. So megaloblastic, I am putting in a word of caution, it is a bone marrow diagnosis. We will have to restrict it to this. Macroovulocytes, compare with the lymphocyte, the RBC is larger. There are some teardrop cells which can be seen, hypersegmented neutrophils. So it is a macrocytic anemia, probably megaloblastic. And this is the bone marrow I have been talking about. Look at the cells. Always identify a cell by the company it keeps. They are all together. So they are all of the normoblastic etiology. Only thing is they are megaloblast. They are large cells. There is an opened out chromatin. Nucleoli can be seen in a few cells. Giant stab forms. It is almost larger than the megaloblast itself. A C-shaped cell. Classical of megaloblastic anemia. Now, my dear students, if this particular slide is given as a chart for you people, how will you explain it? Look at these cells. They are all large and they have got large nuclei. The nuclei is relatively pale. Compared with this is dark and hyperchromatic, whereas in this one, the chromatin is opened out. It is found in the nucleus. Also, the nuclear maturation is lagging behind the cytoplasmic maturation. There is some abnormality I am finding in this series also. They are not megaloblast but belong to the neutrophilic series. So generally it is said that in megaloblastic anemia, there will be a dyserythropoiesis, a dysleukopoiesis, as well as a dysmegakaryopoiesis. This is what I wanted you people to understand. This is called a sieve used for filtering, and the nucleus exactly resembles it. Opened out chromatin, sieve-like pattern. So please mention all these in your answers. Opened out chromatin, sieve-like pattern, compare with the normal blast that is seen. Megakaryocytes are decreased, leukopoiesis also suppressed. And if you still have got doubts, this is a normal bone marrow and this is a case of a megaloblast. These are all normoblasts that we see. Small, dark nuclei. Here they are large nuclei, opened out chromatin. So our diagnosis shall be bone marrow megaloblastic anemia. So the eyes do not see what the mind does not know, but this can be a better code. Some have got eyes, but they can't see. Some can see, but they have no eyes. And I'm an ardent supporter of these, which are my references and backbone. One page, R.A.T.S and game. Thank you.